So just want to start by talking about how unprecedented COVID-19 is. We certainly haven't seen any virus that behaves like this in our lifetime. First of all, just the asymptomatic nature of COVID-19 makes it very difficult to contain. You know, when people get sick with the flu, they are so sick that they are in bed, they are self-isolating. And the fact that people with COVID-19 actually can be out in the community spreading the disease, not realizing that they need to be tested, is what has made it so difficult and required us to do all of the societal level restrictions that we have had to do. The other interesting thing about COVID-19 is how it's really varied in its clinical presentation. So again, we don't have any other viruses that behave like this, where someone might have no symptoms or mild symptoms to severe symptoms, and some people continue to have symptoms many, many months into their infection, and then how some people die from this disease. So, you know, from a risk communications perspective, it's very hard because individuals don't know if they're infected with COVID-19, what type of biological response they're going to have. It's very individualized. Next slide. So just want to again talk about the response of the Department of Public Health and Environment. We had to massively scale up on a dime with this pandemic. We've been awarded $1.165 billion in mostly federal funds, but some state funds in the last 12 months for the department's response. A lot of those funds have been spent on testing. Hundreds of millions of dollars have been provided to local public health agencies, and we've given millions of dollars to the tribes. The Department of Public Health and Environment has been managing an additional 1,616 full-time employees, contractors, and volunteers in the past 12 months in this response. Our state lab has gone to 3 shifts, 24/7, processing an average of 46,000 tests per week. And normally the state lab is not in the business of doing processing individual healthcare diagnostic labs, but we needed to do that for COVID-19. And at the beginning of the pandemic, state public health labs were the only labs that could do COVID-19 testing. We've offered free testing at 121 sites across the state and issued 64 public health orders. So again, an unprecedented virus and an unprecedented scale up. This just offers a timeline. I won't go through it all, but CDPHE actually started to stand up our incident command structure on January 28th, 2020, which was a couple of months, of course, before our first case was diagnosed. On February 28th, the state lab began operations with testing and had a testing capacity of 160 tests per day. Of course, the governor issued his stay-at-home order on March 25th. And on April 6th, we began construction at the Colorado Convention Center in terms of an alternative care site, just not knowing if we were going to have a breach of our hospital system with this virus. Next slide. And this just shows a few other key dates. On July 16th, the governor announced the statewide masking order. On December 4th, Colorado placed its first vaccine order, and on the 14th, the governor welcomed our first vaccine delivery to the state. December 30th, the state lab was the first in the country to detect the B.1.1.7 variant case. And then February 5th, the Dial 2.0 went into effect, starting to relax restrictions as we saw viral transmission come down over the last 2 months. So Colorado has successfully responded to 3 waves of COVID-19. And when I say Colorado, not only do I mean the state's response, but certainly the residents and businesses in Colorado. This is what our true epidemiology chart looks like. The light colored are the actual number of infections that the Colorado School of Public Health has modeled. And you can see in November, we think that there were over 15,000 new infections per day. The dark red bars are actually the total number of cases that we were able to detect through testing. So you can see with the asymptomatic nature of this, there were always many more cases or many more infections out there than we were able to detect. But you can see the downward curve since November, and we actually have been continuing on this trajectory. The first wave, we were successful in suppressing the virus through the stay-at-home order. The second wave was through the mask order and the creation of the dial, which is specific to Colorado. We created that in collaboration with local public health agencies and other stakeholders. And then in November, we were able to suppress the virus mainly through the dial. We did not have to go to a full stay-at-home order. We were able to go to a modified red. Most counties were in orange and red. And we think also through successful communications of the governor, our state epidemiologist, Dr. Rachel Herlihy, giving the painful message that people should not interact with other households over Thanksgiving or Christmas or during the holiday season, and feel like people very much listen to that advice, and we see the curves, and we're successful today because of it. Next slide. And really our main goal was to never have a breach of the healthcare system, that everybody who needed an ICU bed, regardless of if it was COVID-19 or some other illness or injury, always got a bed, that we didn't have to use crisis standards of care, that we did not have to open our alternative care sites. And you will see Colorado is one of the more successful states. If you look at the bar on the right, the stress level shows a low level in green, a moderate level in yellow, a high level in orange. And Colorado only briefly was at that high stress level in November. We never did hit an extreme level of stress on our healthcare systems. We never did overwhelm our healthcare systems. We monitored daily patient transports, and when some hospitals in the state started filling up in November, we were able to transport patients to other hospitals. And so everyone was always able to get the level of care they needed. Next slide. Colorado had multifaceted strategies. We really did not benefit from federal strategies. States were pretty much on their own during this response. Colorado early in the response stood up residential care strike teams for long-term care facilities and significantly increased the site visits for infection control. Colorado did our own private procurement of PPE during supply chain limitations last spring. We have offered free statewide testing the entire time, used the dial framework to manage restrictions on a county level, so we didn't have to do statewide restrictions. The scaling of an outbreak response and contact tracing and using new technology. Of course, the statewide mask order, our data-driven decision-making with metrics and modeling. I mentioned the daily hospital tracking and facilitating patient movement. We had ongoing communication campaigns around masking, distancing, and vaccine hesitancy, our community vaccine sites and pop-up clinics, and finally a vaccine equity initiative that's targeting neighborhoods where there might be vaccine deserts to make sure that no one's left behind. Next slide. So I'm so pleased to introduce Jason Valling today. He's the Public Health Director of Broomfield County Public Health and Environment and co-chair of Metro Denver Partnership for Health. And as I mentioned at the beginning, we just could not do this response without our local public health partners. And Jason's going to say a few words and talk about the response from the local public health perspective. Jason?
Yeah, thank you, Director Ryan. And as was mentioned before, this was really a challenging year for everybody. In state and local public health, we had to scale up very quickly, and we also know the challenges that our community members faced. However, I was truly inspired by the strength, resiliency, and the willingness of Broomfield residents and communities across Colorado to come together to keep our communities safe and show such compassion and love to their neighbors. They stepped up to follow the public health guidelines and slow the spread consistently throughout this pandemic. And I think that's why Colorado has had such success. And this shouldn't be a surprise because this is what we do at the local level. We band together during tough times. Thanks to our existing partnerships with government agencies, elected officials, hospitals and providers, community-based organizations, and schools, just to name a few, we collaborated, pivoted, and solved problems on a daily basis to stand up our community testing, our contact tracing. We're now working on vaccine distribution, but also our support and outreach to local businesses and schools, and most importantly, to those that have been disproportionately affected by the virus. I'm most proud of how we worked as one public health system, as Director Ryan said. Don't get me wrong, there were a lot of tough conversations, but no matter what, we were in this together and supporting each other. From CDPHE's leadership and the weekly calls with us and all of the framework that they put in place to support us at the local level, to the Metro Denver Partnership for Health coming together to work across county lines. We knew we were all in this together. I have never witnessed such strong collaboration in my public health career. It's so important that in Colorado, we continue to do the hard work that's gotten us to where we are today, and continue to wear masks, social distance, and wash our hands as vaccines continue to be distributed. There truly is a light at the end of the tunnel. And finally, I have to recognize our staff, community partners, and volunteers. They worked long hours and provided invaluable expertise to us, but they were always the first ones to give credit to others. They are truly my unsung heroes throughout this pandemic, and we could not have done it without them. And to close, I could tell you there's nothing more satisfying as a public health leader to see our public health nurses providing vaccines to our residents. It is probably the most rewarding experience to see the joy both on the nurses' faces, but the joy on our residents' faces as they're getting the vaccine. And that's public health in action. So with that, I'll turn it back over to you, Director Ryan.
Good morning, everybody. I'm Dr. Franson. I'm the Chief Medical Officer at the State Health Department. Reflecting back on this last year, it's hard not to think so much about all that we've sacrificed. Businesses that were lost, losing jobs, and people looking for new work, being excited about their careers, and finding nothing. We lost connections with family, with friends. We stayed apart from loved ones in residential care facilities. We suffered individually with anxiety and depression. We suffered from our health. We didn't see our doctors. We didn't get screened for routine care. We lived with pain that couldn't be operated on, sacrifice after sacrifice. And of course, we lost almost 6,000 people to COVID over the last year. Friends, family members, colleagues who died from this terrible pandemic. Next slide, please. We responded swiftly and consistently across the year, however, and there is reason for hope. December 14th, when those first doses arrived, so many of us were excited about what this meant for the future of Colorado. Over the next couple of months, we prioritized our healthcare workers, residential care facilities, and people over 65. And I'm happy that over 60% of all doses that have been given have been to those who are most vulnerable, people 60 and over. We know that we'll be expanding our vaccination programs, and this will really provide us an opportunity to quell the end of this pandemic. Next slide, please.
And Dr. France, sorry to interrupt. Your audio isn't very clear. It's a little echoey, and it's a little hard to hear exactly what you're saying.
I'm sorry about that. I'm not sure why. Let me just double check and make sure I have the right. Does this seem better?
Oh, that's so much better. Thank you.
Apologies that I hadn't checked out my microphone, but it had switched to my laptop rather than to my usual microphone.
That's perfect. Thank you so much, Dr. France.
Yeah, just I was describing, of course, the many sacrifices we've lived with through Colorado and the great opportunities that we now see and hope we have thanks to vaccination. We were successful in vaccinating our most vulnerable, the residential care facilities. 100% of our first and second clinics have been completed. And as you see, over 130,000 residents of staff have been vaccinated. Next slide, please. With the third vaccine, the Janssen Johnson & Johnson vaccine now available in our state and expanding our vaccine availability, there'll be even more opportunities for people to sign up and be prepared when it's their turn to become vaccinated. Our vaccine hotline is there to serve the people of Colorado quickly with the information they need so that they can find a vaccine program nearby. Next slide, please. For me, over this last year, I've been so impressed by the number of healthcare providers and leaders in the state who have stepped up and offered their expertise in guiding the state efforts and local efforts. The Governor's Expert Emergency Epidemic Response Committee, or GERC, created 9 important crisis standards of care documents, all done through medical advisory groups that brought local experts together to find our best response to this pandemic. We consulted with medical directors of our nursing homes. We spoke with the chief medical officers of our hospital systems. Over and over again, the physician leaders in the state stood up, offered their time, and really, really contributed to the success that we've seen in the state over this last year. Next slide, please. I'll turn it now over to Incident Commander Scott Bookman.
Thank you, Dr. Franson. Thank you to everybody for joining us today. Testing has obviously been a huge component of our response to the COVID pandemic over the course of the last year. We all know that testing was incredibly constrained in the early days of this response as the world and the country and then Colorado itself worked to scale testing as rapidly as possible. Our state public health lab has been the cornerstone of the testing response across the state. The team there has scaled massively, as Director Ryan indicated earlier, to go from starting out at 160 tests per day a year ago, and we hit our peak at the state lab on November 25th. We did 66,000 tests. And so we have scaled enormously to meet the demand, and we are now doing 11,000 tests a day and have the ability to scale significantly higher. And our goal has always been that every Coloradan who needed a test could get a test, and we have achieved that objective over the course of this pandemic. Next slide. This is not something that we did alone. This is something that we did in partnership with our academic labs, our hospital labs, and our private partner labs, both in Colorado and across the country. And you can see that absolutely incredible and dramatic scaling of testing over time. And testing really is that phenomenal tool that allows us to identify who has COVID, make sure that we're doing appropriate isolation and quarantine, that we're doing appropriate medical care so that we could do all that we could to stem the tide of this virus. And we have done more than 6 million tests across Colorado over the totality of this pandemic, and we have tested more than 2.5 million people. We have also engaged with the Colorado National Guard to do rapid response testing, to do mobile testing. We've stood up drive-through testing sites to meet the unique challenges of this virus. Our laboratory partners have just done an absolutely wonderful job every step of the way in meeting the challenges here. So next slide. I'll turn it over to Dr. Hurley.
Great, thank you. Good morning. So I'd like to summarize some of our key epidemiologic trends throughout the pandemic and really sort of do a year in review of those trends. So starting here with this figure compares the overall cumulative incidence of cases in Colorado compared to the US. And so looking at this figure, you can see that at most times during the pandemic, Colorado's case rate has been lower than the US average. You can see that we did peak earlier here in Colorado, and at that time we did briefly exceed the US rate, but we quickly bent the curve, and since that time we've really been able to decrease the number of cases occurring in the state compared to the US overall. We're certainly not out of the woods yet. We have new challenges before us, things like the variants that potentially increase the risk of more rapid spread. But we certainly have come a long way and have fared well compared to the rest of the US for case data. Next slide. But probably most important is to look at the overall outcomes as far as death trends in comparison between the US and Colorado. So this figure is showing you cumulative death rates over time, comparing the US to Colorado. And you can see that over time throughout the pandemic, at no point did Colorado exceed the cumulative death rate that was being seen in the US. And if you look at the final data point here, so comparing where we are now compared to the US, if you translate this to the number of deaths that Colorado would have potentially had, if we had a rate similar to the US, that's actually a difference of 3,000 deaths. Meaning that the actions that this team took, that our administration took, and the actions that all Coloradans took, so wearing masks, social distancing, avoiding gatherings, all of those things made a difference, and we saved more lives here in Colorado. Next slide. A key role for our epidemiologic teams and our local public health partners has been to respond to outbreaks as they've occurred over time. To put things into perspective, typically in a year, our epidemiologic teams might respond to 100 to 400 outbreaks, and that's outbreaks of all types, all pathogens. In the last year alone, we've responded to more than 4,000 outbreaks in Colorado. So the scale of this response has certainly been quite significant and certainly well above and beyond what is typical for epidemiologists in the state. So you can see that our outbreak trends really tracked closely with the overall case trends that we were seeing in the state, and we used all the tools we had in front of us to try and limit the impact of those outbreaks. This facility is specifically showing us outbreaks in long-term care facilities, and so the tools that we were using included things that Director Ryan mentioned. So our strike team, the testing resources that Director Bookman mentioned, and then the outbreak response activities. And if you go to the next slide, you can see the impact that we've had through these activities. So one of the key measures that we track is the overall average size of an outbreak. And we track that because we know that if we are able to identify outbreaks sooner while they're smaller, and we're able to implement strategies in place to ensure that those outbreaks don't grow, those outbreaks impact fewer and fewer people over time. And that's what you can see in this figure. So since September, with all of those strategies that I mentioned, but I think especially testing being a key strategy, we've been able to overall decrease the size of those outbreaks. And we're now at our lowest point since the beginning of the pandemic, with the average size of those outbreaks being just above 5 cases. Next slide. And finally, the strategy that we were really all waiting for, vaccine, arrived. And this is an early look at the impact that we are just starting to see on vaccination in our long-term care facilities. So this figure compares overall case counts in Colorado in red and shown on that right axis to the case counts that are occurring in long-term care facilities, and that's shown in gray on that left axis. And so what you see here is that those two lines departed from each other once we started implementing vaccination in these long-term care facilities, meaning that we're starting to see a clear impact from vaccination in these long-term care facilities. We're starting to see the benefit of vaccines in really protecting our most vulnerable Coloradans. And so certainly a success that we are seeing, and we expect to see these successes continue to grow over time as we have more and more vaccination pushed out across the state. And I'll turn it over to Director Ryan.
Just to end on such a positive note, if you would have asked me last March if I thought that a vaccine could be developed and distributed for a novel virus in 9 months, I wouldn't have believed it. So the fact that we are where we are today is just so encouraging. There is hope. There is a light at the end of this tunnel. Over 1 million Coloradans have received their first dose of the vaccine. Over 500,000 have received their second dose. And I'm so happy to report that 2 days ago, we hit our goal of 70% of Coloradans age 70 and older being vaccinated, fully vaccinated. And this is so important because we saw 78% of deaths happen within this age group. So we have vaccinated Colorado's most vulnerable first. So in looking back on the year, this is just such a nice way to end. I want to thank my team, our partners, local public health, and certainly all the citizens of Colorado. And with that, I think we're ready to take some questions.
We are, so I will call on you, on all the reporters, and if you can just state your name and the outlet you are working for, that would be great. So let's start with Andrea Dukakis. Andrea, are you there?
Sorry, you guys, I was trying to unmute. Andrea Dukakis, CPR News. You know, numbers show that people of color aren't getting vaccinated at the same rates as white folks. And as the pool expands for vaccines and more arrive, how are you going to ensure that more equity enters into the administration of vaccines? And the other question I have is the Catholic Church has issued guidance to avoid the Johnson & Johnson vaccine because of the use of cell lines. And I wondered how the state is going to approach the situation when folks object to getting the Johnson & Johnson vaccine.
So this is Director Ryan. I can start with the equity question. It's such a good question. We have a whole equity initiative wanting to make sure that no one is left behind. So the state is partnering with providers to host health equity clinics to administer the vaccine. We have a goal of ensuring there's a community-based clinic providing vaccines in 50% of the top 50 census tracts for high density of low income and minority communities. And the zip codes are how we identify these locations. We expect providers to administer the vaccine to any eligible Coloradan who has an appointment, regardless of whether they're a patient with that provider or not. We're also coordinating with local public health agencies, healthcare providers, pharmacies, and community organizations to distribute the vaccine as equitably and efficiently as possible. We recognize that health disparities are not the result of individual choices, but rather the institutional and systemic barriers that have existed long before the pandemic. But we certainly have goals and are monitoring closely groups by race and ethnicity to make sure that we have enough pop-up clinics in the right places in partnership with community to try and make sure that we don't have any disparities in vaccination at the end of the pandemic. And for the vaccine and the Catholic Church, I might turn that over to one of our medical experts to comment about people getting vaccines.
And
Andrew, for
has
the
the
question.
vaccine arrived? Has the Johnson & Johnson vaccine, is it in Colorado right now?
Yes, it is arriving on the ground today. And I'll turn it over to Dr. France.
As I wait for my dogs to calm down in the background for you, Andrea. Thank you for sharing that information about the Catholic Church. There's a long-standing history of religious leaders providing comment on vaccines and their recommendations around that. Apologies, just wait for the dogs to get out if you don't mind. There is a long-standing history of religious leaders providing comment and recommendations around vaccines, and they're always very supportive. Muslim, Jews, Catholic leadership oftentimes will encourage vaccination, knowing that the important public health outcome far exceeds any potential issues from the faith. And so it's the first I've heard about the Catholic Church's concern, and we'll certainly look into it. Of course, we always will honor the fact that a person can choose to be vaccinated or not choose to be vaccinated. And I imagine that someone might choose not to be vaccinated with the J&J vaccine and may look for religious reasons for access to the Pfizer, Moderna vaccines instead. We'll look more into this and see how we can be supportive of each Colorado's decisions on vaccination.
Okay, let's go to John Ingold.
Hi, everyone. It's John Ingold with the Colorado Sun. I have a follow-up question on the Johnson & Johnson vaccine. I think everybody, of course, has seen those sort of headline efficacy numbers, which seems to have created that strong impression in the public's mind that Johnson & Johnson is sort of a second-tier vaccine to the Pfizer and Moderna vaccines. And so I'm wondering about your messaging on that. How do you get around that, and how do you get over a public perception that it's maybe a lesser vaccine? And then when it comes specifically to the equity issues, there's been talk about using it to try to reach more difficult to reach populations. And does that then risk creating an impression that those populations are getting kind of that second tier vaccine?
Well, at the state, we're certainly not thinking of the J&J vaccine as a second tier vaccine. More than 85% effective against severe disease, no death in the vaccinated group, no hospitalizations or low numbers of hospitalizations as we move forward with the J&J trials. So it's been very effective to what's most important, which is protecting severe disease. And of course, it has these great advantages of not requiring super cold temperatures for transportation, long shelf life, one dose only. And as we get the vaccine this week and in the weeks to come, we'll be sending it out to a wide variety of providers. They'll be going, everybody's asking for it. So we're happy to try and distribute that accordingly. More plans are being put together as we speak about how to best vaccinate tens of thousands and even hundreds of thousands of people a week. And having a convenient one-dose vaccine at different sites will be a key part of that work. I'll just check with Incident Commander Bookman to see if he wants to add anything to that.
No, Dr. France, I think the only thing I would add is that we're just really thrilled to have yet another vaccine in state. And the more vaccine that we have, the quicker we can work towards ending the crisis brought on by this pandemic and save as many lives as possible.
Okay, and unfortunately, we have come up on time here. I know that there are still a couple more raised hands, so please send your questions over to media_info@state.co.us, and we will